Good morning, everyone. I'm Dan Gallagher, and in the studios, as we do every Tuesday, we have Dr. Joe and Dr. Carolyn Clauss here. How you guys doing this morning?
We're
Good morning,
doing
Dan.
great, Dan. Good morning to you.
Good morning, North Country. We had a great day today. It's beautiful out.
Yep, the skies are blue, as Dan just said, and the temperature's perfect. And we're here this morning with you to talk about your health and how you can be healthier with taking care of the most important part of your body, your spinal column, your spinal nervous system, and keeping it functioning well. So, again, we're here every Tuesday morning on WIRY at 10 o'clock, and we're here till 10:30. So we want to use this half an hour as well as we possibly can to tell all the folks as much as we can. But again, we definitely would love to address anybody out there's questions about their health or health concerns, and that's what we're here for. So don't hesitate to give us a call at 563-1340, and we'll be happy to address any questions. But we're going to do a little review of what we talked about last week, and we're going to talk about nutrition. We're going to talk about chiropractic and keeping your body functioning at peak performance. We're going to talk about subluxations, and we're going to talk about the effects of subluxations on your overall well-being. And we're going to start off, though, with giving you the question so you can think about it and give us a call, because we do every week. We give a question, and the gift certificate is $50 to our office on the corner of 190 and 374. And our office in the middle of the apple orchard. So if you get the answer to the question and you get the correct answer, it's a $50 gift certificate towards chiropractic care and better health.
Okay, for the question, first of all, just a quick review. We have to realize what chiropractors do, and that's correct subluxations. Chiropractic is not a treatment. It's not a treatment of any sort of disorder. What it is restoring normal function to your nervous system. So with that, which areas of the spine, if you had subluxations, in other words, the areas of the spine where the nerves go to this organ, what subluxations or what areas, namely upper cervical, lower cervical, thoracic, or lumbar, would interfere with your digestive system? In other words, it could give you symptoms such as heartburn, indigestion. Later on, as this becomes more chronic, you have problems like hiatal hernias, things like that. So again, what areas of the spine has an effect on your digestive system? And there's two answers, by the way. Is it the upper cervical, lower cervical, thoracic, or lumbar spine? So when we get that down.
2 out of those 4 are correct.
Yes, I will accept that.
Yeah, so that makes it a 50-50 choice. Okay, so as we talk about that, chiropractic is, once again, the largest licensed non-medical healthcare profession in North America, with approximately 60,000 of us practitioners in the United States. But we are also in New Zealand, and we're in Europe, and we're in South America. So chiropractic has really grown in the last... Oh, we have a question.
Telephone call, line 1. Good morning, you're live with the doctors. Hi, you're live on the air with the doctors.
Hi, is it the lower and lumbar areas?
No, I'm sorry. It wasn't the lower cervical and it's not the lumbar. That was a great try, though.
Okay, well, thank you.
No, thank you for
Thank
trying.
you for listening.
That was great. Speaking about New Zealand, we had the pleasure of going there a year ago, and we visited at New Zealand Chiropractic College. What an awesome place to go. My son Joseph is considering going to chiropractic college there. Oh, we have a call.
The call. Question or answer?
Good morning, you're live with the doctors.
Hi, is it upper cervical?
Absolutely.
That's correct.
That
Thank
is
you.
one.
And your name, please?
Marilyn Schwartz?
Marilyn
All right,
Schwartz.
Marilyn, great.
Well,
Perfect.
Yes, nice of you to call us today, Marilyn. So we'll be glad to get you that gift certificate towards your chiropractic care or anyone you would like to share chiropractic care with at our office. So you can just give our office a call, which is 561-6004, or stop by and we'll be glad to get you that gift certificate, Marilyn. And thank you so much for calling. Do you have any questions?
Thank you. No, not at this time.
Okay, well, thank you so much.
Well, I'd like to go over the answers. That was excellent. And it was a tricky question, but as we keep learning more about anatomy, physiology, we're learning more about our health on this program, it's going to help us all to be healthier. Dan weighed in yet this morning. He has lost 14 pounds in 3 weeks. And what Stan has done is he stopped his soda. He's exercising. Go ahead, Dan. Tell the folks how you've done this. You look great.
Well, thank you very much. One thing that I've learned about dieting, which is a very new thing for me, is that for me it's more of a matter of what you don't do. You know, I love gumdrops. Haven't had one in ages. Love some cola. All different brands. I love them all equally, but I've refrained from it. And just biking to work and just like little tiny decisions really add up. I'm not in the weight room. I'm not going through like Jedi training or anything like that. It's all a matter of just making just a couple different decisions, really.
I didn't see you having birch bark with your lunch today, Dan, so it's not that you've gone that crazy with your diet, correct?
It hasn't been too extreme at all.
And that's what we all have to do is we tell our patients, stop the soda, go for a walk, and you don't have to go on a 20-mile hike. Start with going down to the corner of your road and coming back. And every day you'll find that you have more energy, you feel better. Then when you start losing the pounds and the weights and the pants start fitting loose on your stomach, it's exciting, and it'll really give you that motivation to do more. Now, as far as the answers go, why upper cervical was correct, upper cervical is the key to the human spine. The brainstem, or the medulla, as chiropractors call use and control, extends down from the skull into the upper two vertebrae. This is the part of the brain. It's no bigger than the tip of your little finger. It controls everything, every function in the human body. The vagus nerve extends out of here, and the vagus nerve is the part of the nervous system that slows down the digestive system. It slows things down, brings it back to normal. When you have subluxations in the upper cervical spine, that has a direct effect on all the system, also namely your digestive system. Another area of the spine that has a direct effect neurologically on the upper GI is the thoracics. The thoracic vertebrae, there's 12. They extend from the upper back, lower neck, down to past the mid part of your back. It's the last vertebrae that has ribs. There's 12 thoracic vertebrae with 12 ribs. These nerves from this area, namely T4, the 4th thoracic, roughly to the 7th or 8th thoracic, everyone's a little bit different. These nerves go to your stomach. Some of the symptoms you can have, along with indigestion and heartburn, you can have pain and tightness between your shoulder blades. Difficult to breathe because when you have subluxations, these vertebrae move out of place. They force the ribs to go out of position. Therefore, it's hard to get a deep breath. You have a shallow breathing. So it's very, very important to keep your nervous system functioning. And when someone has a subluxation causing this indigestion or heartburn, and by just taking drugs like, not drugs, but things like Rolaids or antacids, all that does is just cover the symptom. It does not correct it. And it also has not a very good effect on your pH. So it's very, very important to keep healthy. And Dan, you're a walking specimen now.
Well, thank you very much. It feels really good. It's once again, it's all a matter of refraining from fun food and replacing it with other fun food that happens to be more nutritious. Like I'm big into spinach right now.
Papa.
Big into, oh yeah.
That's great, Dan. And with spinach, we know that there's a lot of good vitamins and nutrients in spinach, and we'll talk a little bit about that. We're going to go a little bit into balancing your diet through good nutrition, but also balancing your diet with good supplementation also, which is very important. So many folks out there today are so concerned about their calcium levels, which I agree. Calcium is extremely important. It has a big role in the function of our body. It has a big role in keeping things in balance. The clotting of our blood, the rhythm of the heart, the contraction of the muscles. But it's become a little bit of a problem because there's such a light on the fact that calcium is so important, which it is, but it has to be in balance. Like every nutrient in your body has to be in balance. So it's important that you understand when you're taking supplements that you have to keep in mind that, first of all, your diet has to be good, so you're getting all the fruit, you're getting all the vitamins and minerals from your fruits and vegetables, but also supplementation is important, and I think that taking a good supplement of a multivitamin mineral complex, that's a good multi-mineral complex, but you have to think about that calcium balance. Magnesium is extremely important. If the balance of magnesium and calcium are not in the proper ratio, then we find ourselves getting into an override of calcium. So, and especially if people are taking over-the-counter supplementation, and a lot of the foods now have a lot of calcium added to the foods because of the alert of having, wondering, do I have enough calcium in my diet? But the problem is that we can get it out of balance by trying to overload it, and the system has to have a balance. So magnesium actually has to be in a higher dosage than calcium in order for the calcium to be absorbed properly.
What kind of food is high in magnesium?
Magnesium is high in just about any fruit and vegetable. So it's important that we eat fruits and vegetables and nuts also. But supplementing your diet today with magnesium is extremely important because a lot of our foods today, because of the way they're processed and the way that by the time we get them, even if they are fresh fruits and vegetables, they don't have the magnesium content that is necessary. So we advise our patients and the community too that it's important that magnesium is balancing the calcium intake. So we have this product called Calm, which is a wonderful product, but it's in a powder form that helps to add to the system so that the calcium is better absorbed. Other minerals in the process of bone mineralization. We're all concerned about osteoporosis and weakening of the bones, especially in females, but males have the same situation going on. It's important that the magnesium is in a 3 ratio and the calcium is in a 2 ratio. So it's really 3-to-2 magnesium to calcium. So you got to have more magnesium than you do calcium in order for it to be absorbed. Or you have a flip-flop in the balance. And that's like everything that goes on in our body. It's got to be in balance.
And the Calm is, I only recommend to my patients, I'm probably not good about this, but I only recommend what works for me. And this Calm is awesome stuff. Not only does it help build my bones, which I assume it's doing, but your energy level. And all the patients who do try Calm, they stay with it. It's really a great supplement. If you're out there and you want to have something to give you more energy, Calm is excellent. It's a very, very, very great nutrition. Along with, I also like the liquid organic vitamins. We have a multivitamin in our office that we've been using. It's a liquid vitamin. What's really great about this, other vitamins or multivitamins that I've taken in the past, I have to make sure it's in the middle of the day, that I have to take them on a full stomach, or otherwise, they just don't agree with me and they just kick back at you. So the liquid vitamins I could take on an empty stomach, I could take before I go to bed. They're absorbed through my body really well. And what I love about it, I do notice the difference. In patients who do take these liquid vitamins, it's awesome. And it gives your body the building blocks it needs to heal. Because by adjusting the spine, that turns on the power of your nervous system. Without doing that, you can take all the vitamins you want, your body will not function properly. But once you turn on the power and you correct the subluxations, the nerve interferences in your spine, you want to make sure you have everything there for your body that it needs to heal. That's really important. It works very well that way.
That's why it's so important to have a healthy nervous system, because as Dr. Joe just said, we can talk about nutrition and we can talk about, supplementation and eating proper foods. But as I tell my patients, and I just had a patient in the other night and he still laughs at me when he says, yeah, I know, am I making my Spam turn into broccoli now? Because I gave him the quote of one of my professors when I was taking my upper cervical certification. He said, if your nervous system's in tune, you can eat Spam and it'll turn it into organic broccoli for you. So it's true. If your body's functioning at 100%, you're going to use your nutrients better. You're going to use that better diet and lifestyle better. So it's most important to keep that nervous system at 100% without subluxations. So as chiropractors, that's really what our main focus is to keep that nervous system functioning at 100%. And as a note to that, last week when we were doing the show, we talked about the famous baseball player Johnny Damon and how he uses chiropractic and was happy about his chiropractic care, and that he had done an interview in a sports magazine, health magazine, about chiropractic and the benefits of it. And then the next day, I had one of my very good patients bring in to me from the Post newspaper an article from Johnny Damon. It was like he listened to Wiry and he was listening to what we were saying. So Dan, you have that there if you want to share that with the audience.
Johnny Damon's quotes and the story from the Post. We have Johnny Damon knew he was hurting from some type of abdominal injury, but he had no idea what he was dealing with until he went to see his chiropractor in Orlando on Monday. The source of Damon's pain was not an abdominal strain, as he had expected. He was suffering from 4 of his ribs being out of place, something the chiropractor was able to fix with a pair of adjustments. John said, "I feel like a different person, still sore, but it's more like a bruise than a strain." And with Johnny Damon, we have somebody who's been doing this right out of high school, somebody who's been in upper-level athletics for his entire adult life. So this is a guy who's taken on some wear and tear and who's remained famous over a couple different teams. I like his current team. And just an incredible athlete who's really found something that works, it seems. It's just a couple of different, some articles in medical journals, and now this is the New York Post. This is available like at any stand in the boroughs.
That's correct, Dan. So along with Johnny Damon, there are a lot of other very good athletes and people out there in the entertainment world, as we talked about last week. But, you know, everybody has a spine. So, you know, patients say, "Dr. Carolyn, you know, when I come in to see you, you know, your office is always full of good energy, and you're always full of good energy, and don't you get bored, though, doing the same thing every day?" And absolutely not, because each and every person that comes into our office is extremely unique. And the 2 upper cervical vertebrae, those 2 alone, can move in 274 different combinations to give a specific listing to cause that nerve interference. So as a chiropractor, what we do is extremely profound, but it's very basic. It's working with that nervous system, making sure there's no interruption so that your body can function optimally. Because remember, the nervous system controls and coordinates every organ, every tissue, and every cell in your body. So it's a communication system. And the brainstem is like the switchboard operator. Every single message coming from the brain to the body, from the body back to the brain, has to be taken in, assimilated, and then delivered to the right organ, the right tissue, the right cell. And you know, Candace Purse, I don't know if anybody knows who she is, but she's very famous in the scientific world. She got a Nobel Prize. I think it's about within the last 5 years now she received that Nobel Prize. And what the prize was for, or what her research was on, is that every single cell in your body has a direct communication with your nervous system. Which
chiropractors have been saying for 110 years.
Absolutely. So what Ms. Purse did was in her research, she found that you have those gut reactions that occur sometimes, like if you get a phone call that's upsetting, and instantly you feel your mood change, your whole mentor of yourself changes. Well, that's because every single cell in your body has a direct relationship to your emotions, to the chemistry, and to the function of your body by way of your nervous system. So is it important that your nervous system is checked regularly and that your children's nervous system is checked regularly? Absolutely. Because as we talked about on the very first show, what's the first cause of a subluxation? The birth process. So is there lots of spines out there like Johnny Damon and famous people? Absolutely. Everybody out there that has a spine has to have their spine checked.
What I find is very exciting is when most of our patients choose to come in once a month, they don't want to wait to have pain. It'd be like, again, I used going to the dentist. I don't want to go to the dentist when I need a root canal. I want to go twice a month or twice a year. I want to get checked, and I don't want any decay in my teeth. Same as your spine. When you have symptoms, there's already damage being done at the disc level, at the muscle level, at the ligament level, so you don't want to do that. Coming in and getting checked once a month, it keeps you healthy. And it's exciting for a chiropractor because we have to figure out month to month, what have you done? Is it raking? Is it snow shoveling? Is it water skiing? Is it hiking? Depending on what time of the year, our patients get into different activities. I just had the real honor and privilege. I was coaching the minor league condos pharmacy. And we had the great record this year. I had the best little kids you've ever seen. We were lucky enough to win the championship in Plattsburgh last Thursday night, and seeing all these little kids bouncing around, it was an excellent experience for myself. Jake Sherman and Brian Marino, who have been running the leagues for years, I want to address those guys because they work so hard. It's a thankless job, and they do such a great job, and it's so good for the kids. When you can see all those kids playing baseball and having fun, it was a great experience for me. So I would like to, we tip our hats from Plattsburgh, Jake Sherman and Brian Marino. You did an awesome job this year.
the great group of kids, and they worked as a
And
team.
the parents, I had the best
know.
parents, and I think
Parents are
that's
great.
why everything went so well, because we had just this little team. Majority of the kids are 7, 8 years old. The parents are always involved, always helping out, always working with the kids. So it was a really super experience for myself and my son, Patrick.
Well, it's again when there's consistency and when there's a communion of effort going on, and whether it's in your body or whether it's within the community, we always come out with a better result. There's no doubt about that whatsoever. So when we talk about the nervous system, Dr. Joe and Dan, Dan, you've now, if I can say, you've been under chiropractic care for a little bit of time here. And do you, when I talk to you about those most important two vertebrae in the upper spine, do you remember what they're called?
Is it C1 and C2?
C1 and C2. And I'm just going to throw out a bonus question here. Very good, Dan. Bonus questions for a bottle of our multivitamin mineral supplement that we recommend to our patients, and to some calm for the magnesium balance. So the bonus question here is, okay, Dan was absolutely right. It is C1 and C2 that house the most important part of your nervous system, the brainstem or the medulla oblongata. But if anyone out there in the audience knows, there's two other names, and it's not C1 and C2, that's correct, but there's two other names that those two vertebrae are called.
Ooh,
if you
that's a
can
good
give
one.
me the answer to what either C1's other name is or C2's other name is, and I know my patients know because I talk to them all the time about what C1 and C2 are. So if anybody has the answer to that question, we'll be glad to give you a gift of bonus in our office.
What is really exciting about that was, we have the call.
Great.
Hometown Radio WIRY. You're welcome to call us at 563-1340 to answer questions or to even ask them. Here we go. Good morning. You're live with the doctors.
Good morning. The answer is the Atlas and Axis.
Yay! Wow, very smart, very good, excellent. That's absolutely correct. You got both of them right. And can we have your name, please?
Elizabeth.
Elizabeth, that was great.
That was excellent, Elizabeth. If you don't want to give your last name over the air, you don't have to, but we're going to have to get that, so because there's a lot of Elizabeths out there.
Oh, absolutely.
Okay, great. Thank you. What is your last name, Elizabeth?
Burnett.
Burnett. Very good. Thank you, Elizabeth Burnett, and we'll be glad to...
Stop by the office and we'll have the multivitamin and the calm for you to try. You're going to fall in love with them. They're excellent. You'll even have more energy than your voice sounds like you have already.
Oh, well, thank you. And I'm on my way to New York City tomorrow, so the more energy, the better.
Great. So, there's somebody at our office every day, Monday through Friday, between the hours of 8 and 5, and on Mondays, Tuesdays, Thursdays until 8 o'clock at night. So stop by and we're glad to award you your prize.
You got it. Looking forward to it.
Well, thanks for listening to us.
Sure.
And
You're
give us a
welcome.
call.
That was great.
That was great.
What's really great now that Dr. Jack Jensen has joined our practice 6 months ago. Now we're open every day, so it's really going to be great. We're even looking into the fall, maybe Saturday afternoons, because so many of the patients are so busy. So we're looking into that right now. But between the three of us, all on focus the same way, it's really has been a lot of fun. We're talking a little bit about the importance of X-rays, and there's a case when we give you a question like how many lumbar vertebrae, everybody will say 5. There's only 5. Well, that's true, but on 1 out of 10 folks, it is not true. 1 out of 10 people in the United States have an extra vertebrae, an extra lumbar vertebrae, or one less. This is called sacralization or lumbarization. What it means in English. You have 5 lumbar vertebrae. The sacrum, the triangle bone at the base of your spine, is made up of 5 segments. While when you're born, it's not fused, and as you grow older, it will fuse. But what happens is, with lumbarization, the very first sacral vertebrae, for some reason, wants to become a lumbar vertebrae. And we find it's more or less genetics has a lot to do with it. And the problem with this is when you have 6 lumbar vertebrae, that 6 lumbar vertebrae is never, ever formed symmetrical. I have never seen one in 20 years. They're always either fused on one side, larger on one side. The transverse process, which are little bones that the muscles are attached to, are hooked to the pelvis. So what happens with that, a person who has that extra lumbar vertebrae, it's very important that they do not only get adjusted, that's number one, because they can't afford to be out of line at all, or they're going to get severe symptoms. But it's going to be very important to do strengthening exercises because they have more motion and abnormal motion. So that is another great tool of X-rays. Now, conversely, if the fifth lumbar vertebrae fuses to the sacrum, you'll have only 4 lumbar vertebrae. So what that means is you don't have the normal range of motion. So when you twist or turn, you can't move as far as a normal person, 20%. And what happens is it's a lot easier to pull the vertebrae out of alignment, compressing on the nerves. So when someone has one less vertebrae, or what we call sacralization, it's very important to give those folks stretching exercise, range of motion exercise, along with their chiropractic care, which will give them more range of motion in their spine, more flexibility, therefore not allowing the injuries. Oh, we have a call.
We have a call right here. Once again, if you have any questions, you're welcome to call 563-1340. Good morning. You're live with the doctors.
Yes, good morning, Dr. Joe.
How are we today?
Hello?
Hello? Hello?
Hello, Dr. Joe.
Yes.
Yes, this is your biggest skeptical patient.
Oh, boy.
Oh, boy.
Hey,
I've been wanting to get a hold of you for the last couple of weeks, and it's just I'd like to get the word out that people who have had neck injuries, like myself, where I broke my neck, and even though I got a metal plate in my neck, they can still be adjusted and get some terrific results from it.
well, Mike, I appreciate that. And if I remember correctly, we had to make a little deal to get you to come in, didn't I?
Yeah, actually I did. My wife went here for, I want to say, probably 2 years before, and every once in a while I'd get suckered to bring her in so I can bring her out to dinner. And you made me a deal. I don't know if I should say this.
Yeah, absolutely.
You'll probably be getting 20 calls today.
I'll take them on.
But you made a deal with me that if I went to you and in a month's time I could honestly look you in the eye and tell you that you didn't help me, that you give me back every penny that I spend. Plus, I could take my wife out to the best restaurant in town, and I think you're hooked up with Anthony's or something like that, because that's the name that you were throwing around. That I said, yeah, this guy's full of BS, and you got the right name, because I do like the initials JC, because to me you can all but walk on water.
Well,
like I said, I just want to let everybody know that I was the biggest skeptic that there was. I said, oh, this is just voodoo medicine, and they don't, it's just a bunch of quacks. But I did see you helping my wife, and going through what I've done with a broken neck. I broke my neck in 75, and then I broke it again in 76, because I guess I didn't figure I did it right the first time.
Wow.
And I was really limited to is what I could do. Then I was operated on in 2000. So it helped a lot, but I still didn't have the range of motion that I have today. But I just wanted to take a minute of my time and a minute of yours and toot your horn a little bit, and
Thanks, Mike.
to get the word out. Where, you know, if you've had surgery or extensive injury to your neck, I mean, there's a lot of good that can come from being adjusted.
Well, now you've opened your own business. You're more than happy to tell everyone what the great business and great idea you have. Just tell us about that, Mike.
Well, I've been in the heating and air conditioning business for about 21, almost 22 years now, and last year I decided to go out on my own with my son-in-law and made a family business. And
What's your truck? I love your truck.
my truck is an ambulance.
I hate when you pull into my parking lot. As you said, they're bringing them in, not taking them out.
I'm bringing you in more patients. They come in an ambulance and they walk out. I mean, that's where JC comes in. It's just, I mean, you didn't know something when you were born. He named you right.
Well, Mike, thank you so much for the call, and you know it's my pleasure and fun to serve you and all your family members. Thank
And I do want to toot your horn one more time, and I don't know if this is a normal practice for you, but this man has gone as far as starting my new business. Things are really super crazy, which I'm enjoying immensely. But this man has gone as far as to take me into his home and adjust me at his home after hours, just so that I could get my adjustment. I just can't say enough good about Dr. Joe or Dr. Carolyn. It's a super group. If you go down there, you can be treated like family, and they'll take super good care of you. And I'm going to add one more thing to Dr. Joe's offer that he gave to me. And if somebody can honestly look him in the eye after a month, Dr. Joe, you take their name and they'll get a free cleaning on their furnace or boiler.
Wow, Mike Kelly. Oh, my
I
God.
tell you what, I mean, I've got that much faith in you that if you can't do it, nobody can.
Mike, thanks so much. And
Okay?
yeah,
So